be here with everybody who has joined us remotely. Obviously, this time is really unprecedented. I know we've heard that word a lot in the past couple of months, namely 9 months, right? But we are in absolutely unprecedented times. So in the interest of keeping everybody safe, in the interest of making sure that people are still able to get the information that they need to make informed decisions, really be able to take advantage of a good discount today, all that good stuff. We're bringing this to you via this. So thank you so much for joining us. My name is Michelle. That is my first name. I do have 2 first names. My parents are both from Alabama, so that's how that happened. Excited to be here. I work with the technology vendor. Several of the technologies we're going to be talking about, but I'm really honored to be here with the staff and with Dr. Berkowitz today. Thank you guys so much for having me. So without further ado, we'll go ahead and kind of get into it. I'll go ahead and let the staff introduce themselves.
Hi, I'm Sylvia. I'm the nurse practitioner here at Accents.
Hi, I'm Maria. I'm Dr. Berkowitz's patient care coordinator, primarily selling surgical procedures.
Hi, my name is Megan. I'm also Dr. Berkowitz's coordinator for the non-surgical treatments, and I'm also his nurse assistant.
Perfect.
Hi everyone, I'm Josh. I'm Dr. Berkowitz's medical esthetician here at Accents.
Jessica is having a little bit of trouble right now getting on, but she's our medical assistant in West Bloomfield. She's joining us at the moment, so as soon as she clicks on, we'll have her say hi to you all.
Perfect.
Hi, I'm Christina. I'm a medical esthetician here mainly at the Sterling Heights office.
Hi everyone, I'm Megan. I am a medical esthetician and your body contouring specialist here in Sterling Heights.
Hi, I'm Lana. I'm the receptionist here at the Sterling Heights office.
I think we're having some issues with Julie as well. I'm so sorry. But Julie is the receptionist at West Bloomfield. And again, as soon as we can get her on too, we will have her say hi to you all. I am Danielle, and I am the spa supervisor for both locations.
Awesome. It's never technology without some glitches, right? Never is all about that. Dr. Berkowitz.
Hello, I'm Dr. Berkowitz, and I'm thrilled to have everyone here with us today. I'll ask you, if you're not muted, to mute yourself. And here we are at Accents Cosmetic Surgery in Sterling Heights, Michigan. And we also have an office, of course, in West Bloomfield. This is my 25th year in practice, and what a year it's been so far. I hope everybody's safe. I hope everybody's healthy, and that's our #1 concern. Of interest, as we were able to reopen, the expectations and the volume of questions and procedures that people wanted has increased exponentially. And today we are going to talk about what I believe is the biggest breakthrough yet to date since I've been in practice. And we're going to talk about many different procedures that are in-mode procedures, and one specifically, which is a procedure developed with another doctor. And these are procedures that are going to help turn back time for you. You've come during a perfect time. This is a time where you've made the right decision to attend, because you're going to learn so much today. And I want to make sure that by the end of the day, you're thinking of different things on how you can turn back time. We're going to be able to customize procedures for you to give you the outcome that's most important for you. So at the end of the day, we do have time for consultations, but today's consultations are very limited what's left. So if you are interested, there's Q&A on the bottom. There's also the text number up front here. And with the text number, you can ask us any questions that you have as well. So we're going to get started now, and we're going to be talking about in-mode technology and some great procedures, Evoke, Embrace, and QuickLift. So for the day today, we'll be talking about those procedures. At the end, there's time for questions and answers, so please feel free at the bottom. You can click on to ask questions. Some of you may have it on top as well. And then what many of you are here for, prizes, prizes, prizes. But I'm here for your consultation, and then we're ready to get going. So what's happened over the past few years is that cosmetic surgery has boomed. This is both excisional surgeries as well as non-invasive surgeries. And if you look, you'll see that non-invasive surgeries has overtaken cosmetic surgeries altogether. So non-invasive procedures like Botox and fillers, but the procedures today that we'll talk about will be some non-invasive, some minimally invasive, and some that are still performed within the operating room, giving a whole selection of things to help rejuvenate you. And they're going to make changes for you from 20% to 100% in turn back time, but the most important part is they're going to look natural. Now, part of the reason for all this boom is what you're seeing within the media, and thank you to the Kardashians for bringing it to the forefront. More and more people are looking not just to turn back time, but to try to prevent time from taking its course and developing maybe that first wrinkle or that first brown spot. And so we have the realm of customizing in all different types of procedures for all different types of clients. So Evoke is a procedure that I love. And not only do I love it for performing the procedure, but I've actually had it myself. It's a nice hour-long procedure where we can remold the lower face and cheek area. And so what we're able to do, what we can't do with filler, what we can't do with Botox, is we can remodel that lower face, give a stronger jawline, soften the area where there is jowling, remove, if you wish, some of the fullness in the cheek area, get rid of a bit of that turkey waddle as well, tighten the skin, and it's a 1-hour procedure that is safe, it's effective, and in these days, hands-free, meaning the staff can come in, masked, place the procedure on you. You'll see in a little bit the headpiece that's placed on, and it's actually quite relaxing. I've done it, and during it, I've even fallen asleep. It's like a warm massage for the face. And so it uses an energy called bipolar radio frequency. So those same radio waves that you listen to, when they're placed in a special way, create energy. And that energy can be used on the cheeks, on the jowls, on the submental area and jawline to help remold and redefine and turn back time for you 5, 10, or 20 years time. It's a procedure that's done once a week for, again, around an hour's time. There's no discomfort, and it's something you can read a book during it. You can talk to your friends on your speakerphone. You can watch a movie on Netflix. And what it's going to do is remodel that skin and give you more defined facial characteristics. I kind of think of this in everything that we're talking about. This is the procedure that's going to make a change of around 20 to 30%. And again, everything that we're talking about is for a natural change. It's a change that's not immediate. So your friends will look at you and just say, what is she doing? What is he doing? Every time I see them, they're looking better and better. They must be eating right or exercising. Something, I can't pinpoint it, but they look great. And so here what you're seeing is the two different platforms, one underneath the jawline and around the chin to help tighten in that area, decrease the submental fat, improve that turkey waddle, getting ready for Thanksgiving, and then the cheek and jowl area to help tighten that area, reduce the jowling, the fatty tissue within that area. I think most people need both performed together. When you perform them together, you do get that procedure done in under an hour's time. So you can do it rather quickly, be in and out and back to your regular activities. And there's no downtime at all. So you get right back to your activities without anybody knowing that anything's been done for you. But again, over time, they're going to notice those beautiful changes. And so what this is showing is that the radio frequency that's used creates heat. Now, this is a very, very smart machine. And what do I mean by that is that, yes, we have to create energy to build collagen and to contract the skin, but we want to make sure it's safe. So the machine looks at the temperature of your skin and allows the knowledge of stopping the energy at a point where it's not any longer going to be helpful. So what do I mean by that? Basically, it creates that energy to build collagen, but not to harm the skin. And so it's something that is pure genius in its invention. And what you're looking at here, the red that you're seeing in the untreated area, you're seeing a small bundle of redness. That's collagen bundles. Collagen is the backbone to your skin. And then as it's treated over time, collagen rebuilds. The collagen that you had 5, 10, 15 years ago comes back. It remembers where it needs to be, and it helps to remodel and helps you look more youthful. It is truly amazing. This is a lovely lady who came to me. She was, during COVID, looking on a Zoom call and saying, what has happened here? I'm seeing my mother's chin and underneath her jawline, and I'm not my mother. I don't want to be my mother yet, but I love her. But I need to turn back time. And so what we did, these are 4 treatments, 1 week apart, and she just looks so fantastic, so much more youthful, so much more approachable, and 10 years younger from a procedure that took no downtime at all. And she was thrilled with this procedure. And Michelle, how about you talk about a few of the other parts of Evoke?
Absolutely. So thank you so much, Dr. Berkowitz. It's absolutely, like you said, incredible technology. And obviously I'm a little bit biased, but it speaks for itself. If you can see this picture, I like how they put that little kind of thermal imaging kind of thing, if you will, on this side, so you can pretty, easily see the difference. But like you said, during the holidays, those are the best pictures to get, right? When we're leaning over, or, we're all paying a lot more attention to our phones. We're doing our Zoom calls. We're all looking down. We're getting tech neck. We're, the skin is just accumulating differently, right? In terms of how it's laying with gravity and that type of thing. So if we look at this image, we can see that there's a pretty decent sized fat pocket under here. And then afterwards, of course, there isn't. And I think that really speaks volumes. And also, if you want to take a look at the jawline overall, you can see that that is much more defined as a whole as well. Go to the slide. Perfect. Same thing here. We're really looking at a really good result here. So you can see, obviously, chiefly it's going to be her cheeks. But if you also take a look at her jawline, that's much more defined. You can see that there is a pretty significant difference in terms of the fat on her neck. And even, you could see a pretty deep indentation line, probably from looking down, right? We call that tech neck, or that's, our kind of loose terminology there. But a lot of that is caused from that. So we can see that that is completely gone. Additionally, those cheekbones are coming through. She's looking a lot more structured, more youthful, but not to the point where anyone is saying, whoa, you had some work done, which of course, natural results, if that's something that you're going for, this is absolutely a great option for you. Again, another really great natural result. And while these are good examples, these are pretty common examples. I see these kind of results a lot for people. It's not just kind of like, oh, we're showing you this wonderful thing. This is a pretty common result. It's a result from that radio frequency going in, tightening down that tissue. Radio frequency has been used for 100 years. In fact, the earliest instances were in the 1920s. So it's been 100 years. We know it works. It's safe. It deeply penetrates the skin without harming you in any way. And in fact, the radio frequency even continues on and continues to tighten down that skin and cause an even better result than this. So while he's probably a few months out, he could possibly get an even better result, you know, a few more months out from this even. Again, same thing applies here. We can see a much more defined jawline here. In fact, in the first picture, we really couldn't see much of anything. And of course, his neck is quite a bit smaller. This, I think, really speaks to the real, you know, power behind kind of that wrinkle effect, right? So even if you are someone that doesn't have a lot of fat in that area around the jowl, you know, around the jowls, anything like that, this could still be beneficial to you because it does help, you know, with any of that kind of skin laxity that comes as we age. If you, let's say, you know, you're a patient that's had Kybella done or something, typically what ends up happening with that, because it absolutely does have its place, but what typically ends up happening with that is that you end up with some laxity in that area. So if you are that person or you just naturally have it, this can still be a great thing for you. Again, there we go with that jawline. She's clearly, you know, still herself. You know, she looks amazing, obviously, but not to the point where, you know, it's very clear that she had something done. In fact, it just looks like a really great result, something very glowing, youthful. We can see that a lot of the fine lines and wrinkles are gone, and that little fat pocket underneath her chin is gone as well.
So now I'm going to talk about Embrace. And Michelle, you bring up a good point. You know, radio frequency has been around for years. As a matter of fact, I was the first doctor in Michigan ever to bring in a procedure called thermage, and thermage for the eyelids as well. And thermage was like the breakthrough for radio frequency. In our practice, we have a lot of different machinery, a lot of different procedures. But this, what InMode has done in regard to radio frequency, really has dramatically changed everything. The Embrace procedure is one that combines a few different technologies all in one. So there's one part called Morpheus that helps to tighten the skin, improve the skin. You may have heard of microneedling. Well, this microneedles with radio frequency. So the beauty of that combination is we create these little channels and then we place radio frequency directly into these channels to help build collagen and help tighten the skin. This far surpasses microneedling on its own. So what the Embrace procedure is a minimally invasive procedure. We can do it just with a system like called Pronox. What Pronox is you breathe in nitrous oxide if you want, and it makes it just like the dentist's office where you go through a procedure and then you can drive yourself home. Or if you want, we can give you some medicine to help relax you even further. Some people do the procedure just with numbing cream alone and don't need anything else. But with the Embrace, we're going to do the Morpheus first to help tighten the skin. We make micro incisions. These incisions are so small, in fact, that no stitches are necessary. And I usually make one by the ear and one underneath the chin. And what I'm doing with that is I'm using a part of the Embrace called Face Tight or Accutite to tighten underneath the skin. So I'm tightening not just on the skin, but unlike the Evoke procedure that's just on top of the skin, I'm going underneath the skin to tighten, and so you get more tightening. So with the Evoke before, I said you get a change of somewhere around 20 to 30%. With Embrace, I'm getting changes of around 40 to 60%, and the recovery is very fast. Most people need around 2 days where they kind of look like Scrooge because I put a wrapping around them, again, ready for Christmas. So maybe your relatives can look at you if you want to go out like Scrooge and wear that. And then after that, I ask you just to wear that little band just at nighttime. So this is an area where I can treat the mid and lower face, the jawline and the jowls, but also I can treat small areas on the body. So like the area of the bra fat, or on the arms, the little bit of fat that women see as well. As a matter of fact, this is a procedure that I can have Megan speak to you about because I actually used it on her stomach. And so helped to tighten the skin on her stomach so not to have to go through a major procedure. And so this was a fantastic procedure to tighten the skin for her in that area. So again, the science behind it, what you're looking at here, you're seeing the probe both above the skin and underneath the skin simultaneously. So it's heating both sections. And again, just like Evoke, this is one smart machine. It actually checks the heat throughout and doesn't allow the heat to go too high. It would actually turn the machine off before it would allow any kind of harm to come to you. And this vessel coagulation makes it really where there's minimal swelling and minimal black and blueness, if at all, having anything along those lines. And what the radio frequency does is it melts the fat and it contracts the tissue, so it helps to tighten that tissue for you. Some of the tightening we see right away, but again, this is a phenomenal procedure that you're going to see tightening over time. Over the next 3 months, it's going to get better, and I've seen people even up to a year further improve. So we treat the energy exactly where we want to place it. It's uniform heat. There's no hot spots that occur. I control the temperature, and the machine knows that if it needs to shut itself off, it would automatically do it so as not to cause any harm. So these are the areas on the face. Again, tiny incision can be made by the ear underneath the chin. We stay away from a nerve called the mandibular nerve. And that's something that I actually show you at the time of the procedure and I mark off so it's left alone. And what I'm doing underneath the skin, where you see those red boxes, those are areas I'm going underneath the skin and on top of the skin simultaneously. But then I'm using the second handpiece called Morpheus from the neck all the way to the hairline to improve your skin tone. And people will look at their skin afterwards and they are wowed. The change that occurs to their skin tone is just phenomenal. Plus, if you have scarring, like acne scarring, this is a great procedure to reduce that scarring all at the same time. And if you're noticing your neck and you're saying, boy, I'd love to get rid of a little bit of that turkey waddle, a little bit of that fatty tissue, I can remove that fatty tissue all in one procedure. So this is one I truly love. So, Anne Michelle, you want to talk a little bit about some of the patients that have had it done?
Absolutely. Yeah, so obviously she has an incredible result, right? So what we're kind of talking about here is we've graduated to something a little bit more powerful, right? We're still talking about radio frequency. We're still talking about the same thing that's been used for 100 years, you know, traditionally in a therapeutic setting, but now we've applied it to aesthetics, obviously. So, you know, we've basically gone from something that is, you know, totally non-invasive, you know, it's a really great, you know, short procedure, but you're not going to get to the level, obviously, of results as you would with the Embrace RF treatment or with, you know, FaceTite, AccuTite, depending. So this patient clearly has an incredible result, right? She doesn't have a ton of laxity in her skin. In fact, her skin looks pretty young, but you can see that she probably has a genetic predisposition to some, you know, some basically, you know, laxity here, and it's coming down. Basically her skin, you know, gravity has taken its toll like it always does on all of us. And it's basically created some jowling there for her. So with this procedure, we were able to completely, you know, go in, tighten that skin up, and she doesn't have any of that jowling anymore. And you can see it's really done a great job even on her skin texture as well, which is, you know, just to Dr. Berkowitz's point, it is really great for that as well. I think this is a super phenomenal result, right? So, you know, just like Dr. Berkowitz was saying, we have FaceTite and AccuTite, same thing, just different size implements. So for someone like this who wants it around their eyes, obviously we're going to use something more, you know, a little bit smaller or more accurate. So hence AccuTite. But you can see, I mean, these pictures really, these speak for themselves. We can see an incredible result, even just in, you know, her eyes being more awake. And we all know that, you know, eyes, eyebrows, those are the kind of things that people typically look at first on your face. So when someone's looking at her now, she's looking very bright, she looks awake. You know, this could really have taken care of, you know, any kind of crow's feet she had. We can see on the sides of her eyes, there was, you know, the beginning of some of that. So it's completely taken care of all of that. but it's also really, really helped in her dark circles, as well as just kind of overall lifting those eyelids up. This patient has hooded eyes, which can tend to be actually an issue functionality-wise later in life. So by doing this earlier, she can really kind of help to ebb that possibility or curb that possibility of having to have eyelid surgery down the road because her eyelids just droop so far down. Another wonderful result, this patient obviously does not have, she doesn't have a lot of fat on her face. She is a pretty small framed person. There's not a lot of fat here, just some laxity. We can see some crepiness kind of towards, the bottom of the face, that submental area. Her skin has come down to the point where her jawline really isn't visible anymore, right there on the side. So by doing this procedure, we're able to really see that jawline come through and have a super youthful appearance without, again, doing something that isn't, natural looking. So she was able to have a really great result. Again, a patient probably with just a genetic predisposition to jowling. I personally have a genetic predisposition to this. My mom had this procedure done. She's very happy with it. She no longer has any jowls, and she's very excited about that. She's someone like this woman who doesn't have a lot of fat on her, but really just needed that skin contraction. Obviously, it's also worked wonders for her skin texture as a whole as well. Again, we can see some laxity right underneath here. Right underneath her chin, and that was really well taken care of. Perfectly smooth jawline. A lot of patients come and, they talk about how they want their jawlines back. Typically that means, doing some filler or something like that, which of course needs to be replaced every so often. And absolutely filler has its place. But if you are someone that wants a procedure that's really going to, basically be a weekend of downtime, and you're kind of right back at it, and you're going to have basically permanent results from this procedure, you're working with your body's producing collagen and elastin, you want something natural, this might be the route for you.
So this is actually a patient of mine who came in recently. She was thinking of Kybella, and I pointed her away from Kybella because Kybella, while it would have melted some of the fatty tissue, she wouldn't have gotten the skin tightening that she needed. This is early. This is only 2 weeks out, and we can see the definition in her jawline. Her neck is thinner at this point in time. It's much more defined, and it's actually getting better every time I see her. And I'm excited to see her at the 3-month mark because things will get even better for her. So this is a great procedure, and this is the change in 2 weeks with minimal to no downtime. So this is definitely a procedure I'm very excited about. Another patient of mine, again, using radio frequency to better define along the jawline. She now has a beautiful sweep along the jawline. The neck does not have the fullness that it had beforehand, lift to the cheek as well, and just looks more youthful. Again, somebody who came in for Kybella who would not have gotten the type of results by Kybella alone because there is skin laxity here. So we're able to fix that skin laxity simultaneously with reducing the fatty tissue, defining the jawline, and something that, again, gets better over time. I just love this procedure. So many people will come to me and they say, I see the procedures you just had, but I'm a surgical person. I want to have surgery. Or when I look at them, again, I customize and I'll say to them, yes, if you're comfortable getting 20 or 30%, then Evoke's the procedure for you. If you're looking for 40 to 60%, then Embrace. And before I even get past it, they say, no, I need at least 80% to be happy. And usually the way we know that too is if they take a mirror and if they use one finger to lift up, then we know they're looking for the Evoke or the Embrace procedure. But if they're taking 3 or 4 fingers or their whole hand and lifting up, then they're looking more for a facelift type procedure. But some people don't want the downtime of a facelift. And the beautiful part about the QuickLift procedure is that it gives long-lasting results in a faster procedure than a traditional facelift. So a traditional facelift, you can be in the operating room 5 hours plus. With the QuickLift, it's faster. It's more like a 2-hour procedure, and I get long-lasting 10 or 15-year changes for people. And it's a safer procedure because I'm not making a very large incision like I would make with a traditional facelift. And so this is an amazing procedure both for men as well as for women to help rejuvenate. And again, with everything I do and what I'm known for is giving natural results. And so whether it's Evoke that you're going for, Embrace for the QuickLift, we want you to leave that you're not looking like Joan Rivers did. We don't want you to look plastic. We want you to look natural. And we want your friends to look at you and just say something, you look great. You know, what's been happening for you? So what this picture depicts is you're seeing the red line in front of the ear. That's where I hide the incision. As a matter of fact, I take so much time to hide the incision that even your hairdresser should have a difficult time to see where the incision was made once it's healed. Then what I do, what you're looking at is little purse string loops. These are stitches that are placed underneath the skin. You can't see them, you can't feel them, but what they do is they lift up all of the muscle and tissue that's sunken down, that's created that jowling for you, that's made that cheek fall, or that's caused your neck to fall as well. And I'm lifting things up vertically, not backwards. So many of you may have seen people with a windswept look, that you look at them and you say they look plastic, they had a facelift. That's not what we're going for. Gravity pulls things down this way, so I pull things back up this way, not this way. And so we give you a very natural change. And this again is to show you where that incision is hidden along the ear. So I asked Anne Michelle to add this in, and she just added it today because this gentleman just came back to see me, and he is 2 weeks out from the QuickLift. And so, I mean, at this point in time, 2 weeks out, to me, he looks 20 years younger. It's an amazing change that we've made for him, and he is going to continue to look even more youthful. The results I've given him are going to last him at least 15 years' time. If he had a twin brother, and his twin brother did nothing, and he did this procedure, he'd look better than him 20, 30 years longer. I mean, this is just an amazing procedure, turning back time for him in a very safe procedure. By the way, many of you may not know, I perform these procedures. I have 2 certified operating rooms in my building upstairs, and I only perform it with a board-certified anesthesiologist because your safety and sterility is so important. But this gentleman just is a phenomenal result at 2 weeks out. And so I had to have Anne Michelle throw this in for us so that you can see the change that the QuickLift can make. Here's a lady who actually, after another seminar, came and had the QuickLift with me. And you can see how we've rejuvenated and lifted up her cheek area and just looks more youthful and approachable. Another young lady who said, you know what, I understand the other procedures that you have, but I want a definitive change and a natural looking change. We lifted up for her a little bit of her brow, the cheek area, the jowling has decreased, improved her neckline, and it's just a great procedure. Again, another patient who, after a webinar, after a seminar, came and had a procedure done, and her results, I've seen her for at least 6 years now, continue to improve. And she's amazed every time I see her that she looks better and better and better.
Oh, I'm muted. Just kidding. Talking and talking. Thank you so much, Dr. Berkowitz. Thank you to everyone. We are actually going to go straight into our Q&A portion here, which is so exciting. So if you have any questions, let us know. Dr. Berkowitz is going to be fielding those. And we've got a couple that we've had come in so far. Like I said, if you have any questions that are, just something you want to throw out there, feel free to type it in. And if you have questions that are specific to you, if you have questions that directly relate to your personal goals or something that you'd like to discuss over a consultation, we do still have some spots available. So we did throw that text number up in the chat if you wanted to check that out. And the number is 313-241-3089. So give us a call, just get in touch with us. We'd be happy to schedule that for you in person or virtually, online. So we will go straight into our questions. So we've got one here in regards to forehead lines. This is quite the topic, right?
Mhm.
For most people. So we've got a question about, are toxins really the only way to decrease those lines, or are any of these procedures going to be good to address that as
Yeah,
well?
that's a great question. So toxins, the way they work is they stop muscles from squeezing. So the reason we create the lines in our forehead, there's a muscle called the frontalis, and it works like an accordion. And so as it folds up, you create these straight lines across. So what Botox does is it relieves that squeezing. But the beauty of Botox with the procedures that we just spoke about, something especially like Morpheus. So if I place Botox first, I stop the muscles from squeezing, then I perform Morpheus on the forehead. What that does is it allows collagen to be built without the squeezing. So you get a better change than by Botox alone or Morpheus alone. So the combination of the two, synergism in cosmetic surgery, that's the beauty. When you do 1 + 1 + 1, you don't get 3, you get 7, 8, 9, or 10 in regard to the changes. So to change those lines, yes, Botox is beautiful, but Botox and Morpheus, that's the honeymoon suite.
Okay, perfect. And our next question is in regards to what the Evoke treatment feels like on your skin.
Yeah, so I've had it performed and I'll tell you exactly what it feels like. So the Evoke procedure feels warm. So it's almost as if somebody took, a warm washcloth, placed it on your face, and then it kind of feels like a massage to the area. You'll also feel the heat underneath the area too. And it's something that the heat actually goes up and down, up and down. When you first start, you may say, wait a second, maybe it's feeling a little too warm. And that lasts maybe a second or two. And then all of a sudden you see, hey, it cools off, because you're probably feeling a little nervous in the beginning. What's going to happen to me here? But once you get used to it, we've had people we had to wake up because they fall asleep because it's so comforting to feel that heat within the area.
Awesome. Also, I know we've been talking a little bit about Morpheus 8, but we do have a couple of questions about that. So if you could just give us a quick overview of exactly what Morpheus is and how it kind of ties into the Embrace RF platform.
Okay, so many of you may have heard of microneedling. So microneedling is placing these little needles upon the skin to create channels. And what those channels do is those channels can theoretically allow like cosmeceuticals to go in to allow a change upon the skin. Those little channels don't stay open very long. We have a limited time to make them work for you. So what we're doing with Morpheus is we're creating these micro channels, but then we're simultaneously placing radio frequency into the channels. That tells the skin, hey, I've got to do something here. And what it has to do is to build collagen. So it's telling the skin to build collagen. Now, we can go even a bit further with you and place some exosomes, which are proteins to create collagen for you. We can place your own bloods. You may have heard of a vampire facelift onto the skin. That can be done simultaneously as well. So there's different cosmeceuticals they can use, but the Morpheus platform helps to tighten skin and improve the skin tone, and it can be used, here's the secret, anywhere on the body. So even though we're talking mostly about face, again, for Megan, I used it on her stomach to help with some of that textured, wrinkled skin within that area. Megan, I hope it's okay, I'm telling everybody. And then also it can be used, you know, anywhere if people have crepiness to their skin. So Morpheus platform is a beautiful procedure that can be done not just on the face, but anywhere on the body to tighten and build collagen.
Absolutely. Absolutely. So can you have too much RF is our next question, because I know we've talked about 3 things at this point, right? That include radio frequency energy. Can you have too much of that?
Can you have too much money and too much happiness? I'm not sure. So here's the thing. The answer is radio frequency. The beauty of radio frequency is no, you can't have too much. Meaning, so we can perform it for you. You can get the results and you can say, boy, Dr. Berger, I'm loving this. Can I do a little bit more? You can. We're not going to overdo it. Now, in what I do in life, and my staff laughs at this, I play bartender at times. I tell people when they've had too much. But more, you know, Morpheus radio frequency is not a procedure you can have too much of. It's actually a procedure that when performed correctly, you're going to look more youthful with each advanced treatment.
Perfect. Love that. So we've got a question actually kind of comparing procedures. So what is the difference between Embrace RF and Pixel RF?
So these are brand names. And so it's like Coke, Pepsi, Diet Coke, Botox, Xeomin, Juvo. They're different brand names that are there. The gold standard in radio frequency is the Morpheus treatment. That said, Pixel is a phenomenal treatment. The difference between Pixel and the Morpheus treatment is that with Pixel, we can go down to 3.5 millimeters. With Morpheus, we can go to 4 millimeters. And that extra half a millimeter for some people makes a major difference. But for the majority of people, Pixel is a phenomenal treatment and we will always put you in the correct one. So we offer so many different types of procedures because we're not cookie cutters here. We can customize and we'll point you into the right one that's for you.
And which procedures can be combined with Morpheus 8?
So I combine a lot of different procedures with Morpheus. So I love doing threads with Morpheus. So I will make a tiny little incision and place threads underneath the skin for somebody who's not ready for a facelift and to help lift for them. I like doing Morpheus for people who are having eyelid surgery, who have darker skin types, so I can tighten their skin. Because normally I would use a laser to tighten their skin, but the laser is not something that can be used on darker skin types, but Morpheus can to tighten the skin. I do filler as well, and usually I'll place filler after Morpheus treatments. I can do Botox at the same time. There are very few things I cannot do along with Morpheus.
Okay.
So depending on what you're looking for, I can combine it with other treatments.
Perfect. So we do have a question about kind of longevity. So will you have to have additional Evoke or Embrace RF treatments yearly, or what does that process look like? How long do those results last?
So that's a great question. So with all procedures, I like to have you think about them like a facelift. So if somebody has a facelift and they have the mentality of somebody like Cher, then 2 years down the line, they want another procedure. It doesn't mean that the procedure didn't last more than 2 years. Other people will have the same facelift that Cher had done, and they're going to look better 10, 15, 20 years out. Now, something like the Evoke procedure, what I believe works best is if you have it done, you have the 4 treatments, and then I believe you should come in for maintenance. And that maintenance treatment would be once every 3 to 4 months' time, you come in for an hour, and that will help to maintain that treatment for you. With the Embrace procedure, again, it depends what we're combining it with. If it's a true Embrace where we're just doing AccuTight and FaceTight and Morpheus, you're going to see changes that should last you 2 to 3 years plus. If we were combining it though with filler or combining it with threads, your longevity may be even longer. But again, if you had a twin sister, you had it done and she didn't, you're going to look better than her 5 years out plus. And the QuickLift is, again, like I said with Cher, that's a procedure that's going to last people at least 10 or 15 years time. But there are people who look at themselves 2 years and say, you know, I need a little bit of updating. And again, this is where Evoke can come in too. Somebody who had a facelift, who's now 5 years out, who says, I had the facelift, I still look great, but I want a little bit more optimization. And that's where these other procedures can come in as well. So they don't have to be a start. They can be somebody who already had a facelift who just wants to get a little bit more enhancement.
Okay. And are we planning to have any kind of future events for body sculpting? Because I know that you mentioned we can use Morpheus on different parts of the body. We can use, FaceTite, AccuTite. We can use those implements on other parts of the body. So do you plan on ever having an event coming up where we're talking about body sculpting?
That's a great question. So InMode has a sister to Evolve, into Evoke, and that's called Evolve. And Evolve uses radio frequency to tighten skin on the body and to melt fat. And it also has one other thing, it builds muscle. And so that is a phenomenal procedure on the InMode platform that we are actually the first ones in Michigan to have all 3 of these platforms in our office. And we also offer cool sculpting as well and other non-invasive. Plus, I bring people for liposuction as well and get great results too. So the answer is yes, yes, yes. We will have more on body coming in the future, more webinars on other things besides just body and face. There are other nuances we'll talk about too, even maybe talking about hair transplants too.
Awesome. Awesome. And then we've got a question here. So if someone is kind of like right on the cusp, right? So they have a slight double chin, they're about 10 pounds away from their ideal weight. Would you recommend something like Evoke, or would you recommend something a little bit more intense like Embrace RF?
So again, that's where our face-to-face meeting or our face-to-Zoom meeting comes in. We need to take a look and see what's going to make the nicest change for you. If we feel that, with Evoke, we're going to get 20 to 30%, and you say, boy, if I can get 20 to 30%, have no downtime at all, I'd be thrilled, then that's the procedure for you. If you'd say, well, 20 to 30%, boy, I'd rather have one procedure and shoot for 40 to 60%, then Embrace is the procedure for you. So we'll sit down and talk. Now, the other part is there are some people who may start with something like Evoke, say, I'll see the change I can get. And then if it's not enough for me, I know I can always do Embrace or the QuickLift in the future. And maybe I want to just do something that will hold me over for 2-3 years' time. So that's part of the whole conversation that we're going to have. We want to make sure it's ideal for you. Just because Mrs. Jones, your neighbor, did Evoke, doesn't mean it's the right procedure for you. And so we're going to take the time to find the right procedure that makes you happy.
Right, absolutely, that's great. So we've got time for one more question, and that question is regarding fillers and toxins. So with these different procedures, with Morpheus 8, with Evoke, all of that good stuff, how long do you need to wait to have fillers and toxins? Or how long do you need to wait after you've gotten fillers or toxins to have these procedures done?
So that's a fantastic question as well. So let me preface it with this. When we take fillers are sterile. Part of the sterilization process is to bring these fillers to very high heats, much higher than we're going to with Embrace and Evoke. And because it's so much higher, we know that doesn't melt the filler. So the filler can withstand very high heats. And because we're not going at the same plane as the filler is placed, I'm not concerned that if you had filler 2-3 weeks ago, that we're going to be melting that filler. It will not harm Botox in any way. But if you do have a question, there's no harm in doing the Embrace procedure first or Evoke first and then doing filler afterwards. But I'm not concerned doing the reverse for you.
Okay, awesome. Well, thank you so much, Dr. Berkowitz. Thank you so much to everyone who's joining us. Thank you to the rest of the staff as well. We are all out of time as far as questions goes. We've got to hop right into our consultations. But like I mentioned before, we do have a couple of spots open. So if you haven't already scheduled a consult with us, just like Dr. Berkowitz said, this is a great opportunity to really get your personal questions answered, questions about your goals, how to meet them, what that looks like, what a treatment plan is really going to look like. And we can do that virtually, like I said, or we can have you come into the office, whichever you're more comfortable with. So whichever way you'd like to go there, we'd be happy to accommodate you with that. And then we do actually have some prizes as well that I'd like to mention. So we do have a grand prize, and that's $500 off of your total treatment package, which is really, really exciting. And I believe we are going to draw that grand prize winner tomorrow, correct, on social media?
That we're drawing tomorrow on social media, that's correct.
Perfect. So if you don't follow us already, go online, follow us on Facebook and Instagram. We are up there and we are going to be announcing the winners there. Just in case you are not able to follow us or you already do and you've got to work tomorrow or something, we are going to contact you via phone. But it is still a great way to learn about specials, learn about things coming up, learn about what we're up to and what you can expect down the road. Just like Dr. Berkowitz said, we do have some body sculpting coming up. So if that's of interest to you, definitely go and check out those pages. We've also got some door prizes, and those door prizes are really phenomenal, but we are going to be drawing them on the consultations. Just a little added incentive there. So if you haven't scheduled with us, go ahead and do that. Even if you just want to win a prize, we'd be happy to talk to you. But without further ado, thank you all so much. Thank you, Dr. Berkowitz. Thank you, everyone, for coming, and we hope you stay safe and well out there, and we're looking forward to seeing you in the future. Thank you.
Bye-bye. Thank you.